Imagine living with a disease that only a few thousand people in the world have, where your bones can fracture from something as simple as walking. For me, that's been the reality, but there is a treatment that's changed everything, and this is my story of living with hypophosphatasia and how life altering drug Strensiq gave me hope. Hey everyone, it's Aaron. Welcome back to my channel. So you just saw me injecting Strensiq, the drug that I use to treat my hypophosphatasia, and that's what I want to talk about today. I want to talk about Strensiq. So I get a lot of questions about the drug. So what is it? What is the injection like? Why am I on it? Has it helped? What's the routine like? So with all these questions, I just wanted to put a video out there and talk about my experience with Strensiq. But I do think it's important to talk about hypophosphatasia, the disease that Strensiq is treating that I have, and what led me to get on this treatment and how that came about and what's going on now. How am I doing since starting Strensiq? What has it done for me? What it hasn't it done? So I want to talk about all of that. So let's start with hypophosphatasia. So I live with hypophosphatasia. It's an ultra rare genetic metabolic bone disease. So in people with hypophosphatasia like me, we have a genetic mutation that does not allow our body to make an enzyme called alkaline phosphatase, not make enough of it. And alkaline phosphatase is an enzyme that's extremely important for bone health. It allows calcium, magnesium, phosphate, these minerals that are very important for bone health. It allows them to get into that bone. If you can't have the minerals that get it, if they don't get to the bone appropriately, then you don't have strong bones. Not only that, the calcium, magnesium, phosphate that should go into the bones, what happens to it? Well, it has to go somewhere. So specifically, the calcium will start depositing on organs like the kidneys. You can have calcium deposits in your eyes. You can have calcium deposits in the ligaments and the tendons around the nerves. And so it causes damage. The calcium can damage the kidneys, the ligaments, the tendons, the nerves. And so it causes a lot of other additional problems that are outside of the bones. And so people with hypophosphatasia have very weak bones or soft bones. They fracture very easily. They have skeletal abnormalities because of it. And then they also have issues with their kidneys and can have issues with the ligaments and the tendons and the muscles because of the calcium deposits. So it's just a sort of like downwind thing of where your alkaline phosphatase or downstream effect, the alkaline phosphatase, you don't have enough of it. Calcium magnesium phosphate cannot get into the bones. Calcium magnesium phosphate then can get onto the organs, causing organs damage, and you also have very weak bones. So alkaline phosphates, it's very important. It also regulates things like B6 in the blood. It regulates something called PEA. It's like phospho. I'm not even going to try PEA. It's just another thing that it effects. And so the vitamin B6 and the PEA levels in your blood are typically really high because of it. The alkaline phosphatase is not regulating it. And so there's just this whole slew of things that alkaline phosphatase affects. And that's what gives you all the symptoms and signs of hypophosphatasia. And so what happened with me? What's a little bit of my hypophosphatasia story? So I have some of the very classic symptoms of hypophosphatasia. I was born with bowed legs, which is very common in hypophosphatasia. I was born also with scoliosis and something called kyphosis, which affects the top part of the spine and the shoulders. And then as I grew up and got older, I started breaking a lot of bones as a kid. I had a lot of bone pain. Anytime I would take a fall, I would typically break a bone. And so I was very affected by this. I had teeth issues, so I was always at the dentist. I was having teeth pulled and cavities, and I had a lot of dental work as a younger kid, and even still now. And so I was experiencing those classic symptoms of hypophosphatasia, but had no clue. And throughout my childhood, especially into my adolescent teen years, I continued to break stuff. I had surgeries. I broke my wrist, my shoulder, my fingers, my nose, my face, just a ton of bones. And when I was 18, they told me that my hips were going bad. When I was 20, I had hip replacement surgeries. When I was 24, I dislocated one of my hip replacements and they had to go back in and redo both of my hip replacements. So this disease took a giant toll on my body. And all of that happened before I was even diagnosed. It was not diagnosed until I was 25 years old because of how rare this disease is. And so hypophosphatasia affected my body so much and so severely that I was struggling when I got to my diagnosis. I mean, my mobility was limited. I was in a lot of pain. I had bone scans that showed my bones were extremely weak. And to compound everything, I had been diagnosed with Crohn's disease when I was 17. I had been on a little bit of steroids to treat it because it's a immune-mediated disease, and steroids are often used to really get the disease under control quickly. The steroids are not good for your bones, and they're definitely not good for people with hypophosphatasia, but we didn't know that. And so the steroids just really cause things to kind of go into overdrive as well. And so I was going through it, but before my diagnosis, I mean, I was 24 years old and had already had double hip replacements and bilateral hip replacements plus the hip replacement revisions where they took everything out, put them back in. I had already had a lot of other surgeries. I had 4 shoulder surgeries at that point, and it was a lot. My body was just really being put through it with this disease, and there wasn't any kind of answer. And I've talked about my diagnostic story before, where I came up with the potential diagnosis of hypophosphatasia. After several months, turned out I was right. So from then on, from when I was diagnosed at 25 years old, I did not immediately start treatment. I did not know that there was a treatment and initially, and then when I found out, I wasn't really sure that I was going to even be able to get on the treatment. The reason for that is because if you read into the treatment, it's only approved for a certain type of hypophosphatasia. It's very specific criteria where you have to have shown signs and symptoms of the disease prior to being 18 years old. And that means showing low alkaline phosphatase, which is checked via blood work, and that you've had at least a fractured bone, dental work, just something that in conjunction with the low alkaline phosphatase that would suggest that you had undiagnosed hypophosphatasia. And so I was 25 at the time. I got my hip replacement my hips that were going bad, that diagnosis at 18, so that wouldn't count. So we really had to. I was like, I don't think that I could get on this. I don't know if I could. Obviously, I had it, but I don't know if I could prove that. And so eventually, after my diagnosis, about 5 or 6 months after, my care got moved to out of state. So I moved to see a doctor who's very familiar with hypophosphatasia and the drug and everything that comes along with it. And it was a great decision. That was like January of 2018. And after seeing her, we made a decision together. After she did full body X-rays and going through my stuff, we made the decision and agreed that I would probably benefit from Strensiq, and that I would benefit from it, and that she believed that we could prove that I had the symptoms and everything prior to 18. So I had to do a lot of digging. I had to get some old medical records, and luckily found enough. And about 6 to 7 months after, I believe it was July of 2018, I began Strensiq. And it comes in little vials like this. So this is Strensiq. And I started it. So let's talk a little bit about what Strensiq is. So it is an enzyme replacement. It's an injection, as you've seen, but it's an enzyme replacement. It is alkaline phosphatase. It's the enzyme. So the treatment for hypophosphatasia is replacing that enzyme via Strensiq. And so it's a subcutaneous injection. When you saw earlier that I injected, I did it under the skin in my thigh. And for me, it's 6 injections every single week. So I do 2 injections 3 times a week, and I've been doing that since 2018. It's a lot of a lot of injections. It can be hard to keep up with sometimes. And remember now, I know, and I get reminders and stuff. But it's a big adjustment going from I was on 1 injection for Crohn's disease, going from 1 to 6 basically. So I was going to 2 injections per month of a Crohn's disease medication to 24 injections of another medication. So now I do 26 injections every month. So it's a lot. It's not easy. It's something that is uh, hard to kind of get your head around for sure. And so, but I started it in early 2018, middle 2018, and have been doing it ever since. And I'll be honest with you, I mean, there have been times where I've missed injections, I've gotten behind, and I'm human, I'm not perfect, and especially when life gets hectic and from going out of town or something, I've forgotten, and it's not the end of the world. I try not to make a habit of it. Let my doctor know if it's something that I really miss a lot of injections, but overall, I've pretty much stuck to the schedule of 6 injections every single week since 2018, and it's a lot. So with Strensiq, it's the 6 injections for me. It may not be that way for. It's definitely not that way for a child because it's weight based, but it is 6 injections, and I can inject in my thighs, the back of my arms, in my butt, or in my stomach. I do a lot of injections in my thighs because I typically like to do my humera in my stomach. I've used the back of my arms. The back of my arms hurt the worst, pretty painful, and I've done my butt, I think, once. And so I try to rotate as much as I can, but I do tend to gravitate towards my legs and my thighs. It's just easier for me. It doesn't hurt as bad. With that being said, what does the injection feel like? It's not pleasant. I inject with the syringes like this, and it's got a small needle. The needle doesn't really hurt, but the medication burns, and so that's something to get used to as well. I mean, the burning medication, it's not fun to have to inject and then inject a medication that hurts. So it's something that you just have to really just kind of power through and get used to. It's not a ton of medication, but it does hurt. It can be painful, especially if you get it and if you just get it in the right spot. It hurts. So that sucks. That's a downside, is that it's a lot of injections and they're not pleasant injections. Um, However, the drug has honestly changed my life. I Prior to my diagnosis and leading up to everything, as I told you, I'd had my hips replaced, and when I was 20, at 24, they had to go back in and redo those hip replacements, and my body I'd broken a ton of bones, was in so much pain. I knew that my body was getting to a point to where I didn't know how much longer it would be before I really needed some assistance in terms of walking or getting around, and I was worried. Honestly, I was scared of what to come, because I knew that my body was just really taking a hit, and that I could tell that something was just really, things were getting worse. And so by the time I was diagnosed, I'd already been through all of that, and there's with the diagnosis, there's a lot of unknowns. There's some scary stuff of, okay, what does this mean? If there's a treatment, can I get on it? And all of that. So, but I knew up to that point that my body was taking a beating, and that I didn't know how much longer it would be before just the last broken bone or something would be the one that puts me in a wheelchair for the rest of my life. And that was just something that was very concerning to me. So, what's changed since starting Strensiq? So I talked about a little earlier about there are certain things that we can look at to that alkaline phosphatase regulates: B6, the PEA, calcium magnesium phosphate. You can also check your alkaline phosphatase level with Strensiq. Once you're on Strensiq and started, that alkaline phosphatase level is going to be extremely high because of the injection. But you can at least tell that when you're looking at the blood work, you can tell that I've been on the enzyme replacement. But things that have changed. So initially, my vitamin B6 level was around like 10 times the normal limit of the upper limit when I was diagnosed. Calcium, magnesium, phosphate were high, or on the very highest point of normal. And then my PEA levels were also really high. And after I started Strensiq, that was in July. I believe I went back 6 months afterwards, and I have all the same blood work done every single time: the B6, the PEA, the calcium, magnesium phosphate, alkaline phosphatase. I have all that done every single time I go in. And after about 6 months, my B6 levels normalized, my PEA levels normalized, calcium, magnesium phosphate came down. They're still, even today, they're still just a little on the elevated end, but they have decreased since that initial appointment that I had. So from let's say a biochemical standpoint, from a blood work standpoint, Strensiq is doing its job. It's decreasing those B6 levels, the PEA levels. It's starting to regulate those things in my body that need to be regulated. with that, but how does that make me feel? Like, how do I feel? Can I tell? And so, yes, I can. I've not really broken a bone since I've been on Strensiq. I broke one. To be fair, I broke one bone in my hand earlier this year. But I took a really hard fall and hit it on concrete, and honestly, probably anybody would have broken a bone. That bone, it was a really hard fall. But overall, not really broken anything where I haven't just tripped and fell and broke something. I am in less pain. I still deal with a lot of pain, but it's definitely decreased. One thing that I had prior to Strensiq is I had headaches, and those went away, and that was a big thing for me. Honestly, that was one of the things that I noticed really quickly was that these headaches that I kept having were going away. And I had a additional bone scan, I think about a year after I started, and my bone scan normalized. I will say that bone scans don't always give us the best picture of bones and hypophosphatasia, just because of how the bones are in HPP. It doesn't mean that my bones are just as strong as anybody else's. But there was a positive increase in bone density from pre-strensiq to post-strensiq, and that's a good thing. The one other thing that they do check every time I go in is I do a 6 minute walk test. They time me for 6 minutes and just measure how far I can walk. And this is just really there. This was something that they realized that Strensiq could help and kind of like stamina and like the body's ability to continue to walk and keep up with everything. My From my original 6 minute walk test to current, again I have it done every time. The length that I can walk in that amount of time has increased, and that's a good thing. So these are things that Strensiq has helped. I can feel that it's helped. If you keep up with me at all, you do know that I still have a lot of surgery. I've had a lot of damage to muscles and ligaments and tendons pre-Strensiq, and I have arthritis, and my body went through so much prior to diagnosis that it still deal with a lot of that today, and I still have a lot of surgeries and things of that nature. But overall, I'm much better. It's decreased a lot of things, and I think that has slowed down some of the progression of this disease, and I'm extremely grateful for that. And while it's not pleasant to have to do 6 injections every single week, it's worth it, in my opinion, to do that. It is worth it to have to go on to do all those injections that aren't necessarily the most pleasant to get the benefit of it, to get the benefit of Strensiq. And it's a safe drug. It's genuinely a life altering drug. And one thing I wanted to that I saw was really cool is that there were patients. So some of the severest forms of this disease, babies are born where you can't even see their bones on an X-ray. Like it's just not there. Some of the clinical trials, there's pictures of babies who have X-rays where you can barely see their bones, and then they start Strensiq and they start doing X-rays as they're on it, and you can start seeing the bones develop. It's crazy, but that's the kind of drug that Strensiq is. It makes that kind of impact on the body, so it's incredible. It's been a long journey. I will have to be on this the rest of my life unless something drastically changes. I will have to be on it the rest of my life, and that's just part of it. It's part of this disease. But I will take that over not being able to walk and not being able to be with my family and my kids and to enjoy their life and enjoy my life. Again, it's not perfect. It's not a cure, but it's definitely life changing for me, and I'm extremely grateful to be on it. And so there are some things that I do wish, right? I wish that it didn't hurt. I wish that more people had access to this drug because, again, not everybody has access to it. It can be hard to prove, especially if you get diagnosed older and you don't have access to your older records. You're not really going to be able to get on it. And so I wish more people had access to it. I wish that it wasn't so expensive. To be fair, I've talked about this before. For me specifically, because it's weight based, it costs about $1.6 million a year for kind of insurance. So it's not easy to get on for that purpose. It's an expensive drug. So my hope for the future is that it gets cheaper, so more people have access. That maybe that it can be developed where it doesn't hurt as much. So there are things that can be done, and I know that things that are being worked on to hopefully improve the drug and improve the lives for people. So with that, that's my story of Strensiq. It's a great drug. I'm grateful for it. I wish more people could get on it. I wish everybody with HPV who needed it could have it, and I hope that that changes in the future. I do a lot of injections that aren't pleasant, but in the end, the benefits of the drug outweigh all of the negatives, and so that's my story with Strensiq. I know that it can be scary to start injections, a new medicine, especially a new medicine that's an injection. I get a lot of questions about it, and I wanted to try to answer those and provide some input and some reality to it of what it's really like being on this drug. And so that's my story with Strensiq. If you have any questions, please let me know. If you have any questions about self-injecting, let me know, or Strensiq or Humira or anything like that, or just need to talk about it, I'm always here. I've been injecting for a long time, and I know that it's scary and it can be hard to do. So please let me know if you want any tips or just advice. Happy to give those. And please like and subscribe. I'm out here. I'm trying to share as much as I can about this and to share my story, and so other people will have hope. But thank you for watching and following along, and I hope that this helps. And I'll see you next time.